Histotripsy is a non-invasive medical procedure we can offer patients that uses high-intensity sound waves to destroy liver tumors. And essentially the idea is that the ultrasound waves kind of come together and create almost like a blender effect, and it liquefies the tissue within the target organ. I'm Omar Hasan. I'm one of the interventional radiologists here at Roswell Park. So what's unique about histotripsy is that A, it's non-invasive, so there's no incisions, and then B, what we found is that we're able to treat close to critical structures that we wouldn't be able to using other modalities because the technology will destroy the tumor but will preserve the bile ducts and blood vessels. So, there are a lot of patients that that have sort of smaller tumors that are hesitant to undergo a large operation. I think it would present a non-surgical option that would be, really beneficial to a patient. Most histotripsy procedures are same-day procedures. We'll bring the patient in the room, we'll put the patient to sleep. Usually the procedure, can last anywhere from 1 to 3 hours, depending on how many lesions we're treating and the difficulty of the location. Once the patient wakes up, we bring them back to the recovery area. They typically recover for 2 to 3 hours. We get a CAT scan about an hour after the procedure just to make sure everything's looking good, and they go home the same day. So histotripsy is FDA approved for liver tumors. Other times when patients are on chemotherapy and you have a single lesion or a couple lesions in the liver that are growing, we can treat those lesions with histotripsy. Again, the non-invasive nature of the treatment allows patients to stay on their chemotherapy while we do the treatment. Histotripsy may not be right for every patient, but we have other modalities, whether it's thermal ablation or embolotherapy. We have all the tools in our toolbox. We're really able to personalize the treatment to the patient and their specific tumor type. We're a very high volume liver center in terms of treating both metastatic and primary liver cancers. We have multiple specialists that take care of the patients that then we come together and come up with an individualized treatment plan. I think is really, really important.